Buenos dias. Good morning, everybody. I want to thank everyone for attending today's webinar that we have sponsored by MD Anderson. I want to introduce our moderator, Gracie Pequeño, which is with Brazoria College, and she is also one of our board members. So thank you, MD Anderson, for always supporting our events. And I think this is a very good topic that is very close and dear to my heart, because I think this is something that we need to get out to our community on some of the things that we need to look for. You know, I have some family members that have passed from cancer. So I think this is a very important topic and something that we really need to know. So thank you again. Gracie, you can go ahead and take over.
Well, good morning. Again, I'm Gracie Pequeño. I am a board member of the Hispanic Chamber. I'm here to be the moderator. Today, we're going to have a café y pan dulce with MD Anderson. Café y pan dulce is a cultural event that we love to do. We love to sit around the table with our family and friends and drink a little coffee and eat a little sweet bread and talk about important topics or just pass the chisme. But today we're talking about 9 ways that you can reduce the risk of cancer. So today we have with us M.S.E.D Acevedo. She is the community relations specialist with MD Anderson. She will be helping answer your questions that you can put in the chat box at the end of the presentation. Again, so if you have any questions, put it in the chat box. Ms. Acevedo will read them out at the end of the presentation. Our key speaker today is Ms. Patricia Priego. She is the Senior Community Health Education Specialist in Strategic Communications at the University of Texas MD Anderson Cancer Center. She provides cancer prevention education and outreach efforts in the Hispanic communities in the greater Houston area. Ms. Priego graduated from the Southern Illinois University with a master's degree in education. She also has a master's degree in public health from the University of Texas School of Public Health. So without further ado, I'm going to pass it on to Ms. Patricia.
Thank you, Grace, and glad to be here. And thank you very much for inviting us. It's always, MD Anderson always appreciates partnerships, important partnerships like this one. And thank you for having us. And yes, today I'm going to discuss with you.
Patricia.
Am I sharing?
Yeah, but we can see, we need to see the actual presentation. It's not up yet.
You don't?
Yeah, we don't see it yet.
Now?
There we go. Looks great.
Thank you, Yvette.
No problem.
And we thought we'd practice. It's okay. So yes, I'm going to be discussing with you 9 ways to reduce your cancer risk. And like Gracie mentioned, you can please type any questions that you may have in the chat room. I would suggest don't wait until the end to type them, because sometimes you may forget, even though at the end you may see that maybe you answer, but just go ahead and type it, and Yvette would read the questions for us. And I have a problem with my mouse. Okay, so just a quick reminder, the best things you can do to prevent the spread of coronavirus are practicing social distancing by staying at least 6 feet from each other. Don't forget washing your hands frequently with soap and water for at least 20 seconds. Wear a mask or cloth facing covering over your nose and mouth in public. Get tested, and I hope you can get also the vaccine. So let me ask you, everyone, some people may think it doesn't matter what I do. If I'm going to get cancer, I'll get it no matter what. This some people believe, but actually up to half of the cancer deaths in the United States are thought to be preventable. So these statements are not true. You can control many of your daily habits, and I'm gonna discuss all some of them now. So cancer is not inevitable. This means there are actions you can take to lower your risk and tests that your doctor can use to detect these cancers in their earliest and most treatable stages. And remember, focusing on your overall health and well-being can also help you stay healthy and cope better during these stressful and uncertain times. So let's start with tip number one, maintain a healthy weight. Maintaining a healthy weight isn't just a matter of appearance. About 1 out of every 3 cancer deaths in the United States is due to obesity and overweight, lack of physical activity, and poor nutrition. So, according to the American Cancer Society, being overweight or obese increases your risk for several cancers, actually up to 13 type of cancers. So if you need to lose weight, it sounds easy. Eat fewer calories and burn more calories by exercising. Sounds easy, right? But I know it's not that easy. It's challenging, but it's doable. Remember that not overeating is just as important as exercising. If you are exercising, but you are overeating, your body fat stays high and your cancer risk may not be the same as a person with less body fat. Also, good nutrition during stressful times can boost your mood, prevent unwanted weight, and reduce your risk for cancer and other chronic conditions. Um, People who are obese have an abnormal high and unhealthy proportion of body fat. So one way that we can find out to measure if we are obese or normal or overweight is you can go and figure out what is your BMI. It's a very easy way to find out if we are overweight or obese, or if we need to lose weight. So I would encourage everyone. You can go online and figure out what is your BMI. BMI is only a way to find out, and we need to know that a normal is a number you're gonna get by estimating your height and your weight. It's gonna give you a number, and that number is gonna be your BMI. The normal BMI should be of, this is for adults 18 years old, men and women, and it will give you what will be your normal BMI according to your height and weight. So let's consider how healthy food choices can lower your cancer risk. So what types of food you should eat? We recommend that we should fill 2/3 of your plate with plant-based foods at every meal. Plant foods include vegetables, whole grains, and fruit. Then the other third of your plate can be lean animal protein like chicken or fish, or plant-based protein like tofu, nuts, or beans. Okay. Research has shown that eating more vegetables and fruits greatly lower your risk of developing several cancers. Remember also, whole grains are another plant-based foods loaded with fiber. For example, you can eat brown rice or wild rice or quinoa. I said quinoa, however you pronounce it. Or whole grains are great sources also of fiber, and they're also considered plant-based. Okay, and remember, eating the best possible foods will boost your energy and will strengthen your immune system. So just as you should focus on eating more plant-based foods, you should limit some of the animal-based foods you eat. So limit how much red meat you eat each week to no more than 18 ounces of cooked meat. Red meat includes beef, pork, lamb, venison, goat, all those things. So no more than 18 ounces a week. Now, the recommendation is the serving size would be around 3 ounces. So you can split those accordingly, however you prefer during the week. As you can see, you can have small portions every day if you prefer, or you can have maybe like on the second line, 6 decks of cards approximately, that this is 3 ounces per serving. This is the recommendation. Or if you can do it only 4 times a week or only twice a week. So this is some ways to see how to reduce red meat, cook red meat. So the other days you can eat more, chicken or fish. Okay, consuming more than 18 ounces or a little over a pound of red meat each week can significantly increases your risk for developing colorectal cancer and other cancers as well. I skip one. My mouse, sorry. Okay, so give me a thumbs up. I don't know if you can see them. You do have a bottom at the end of your screen. You can click buttons up if you believe that eating processed meats like bacon, dairy meats increases your cancer risk. If you gave me a thumbs up, yes, eating processed meats like bacon, deli meats does increase your cancer risk. My mouse is not working. Sorry. I don't know why. So, yes, cancer causing substances form when processed meats are preserved. So, for cancer prevention, it's best not to eat processed meats. Processed meats include bacon, sausage, hot dogs, pepperoni, all the deli meats. And yes, even like some people may think, oh, I like turkey or bacon. No, even if it's turkey or chicken, it still is considered processed meats and we should avoid it if possible. Okay, so you should focus more on substituting those maybe with more veggies or fish, fresh fish or chicken, whatever, but other meats that you can, but avoiding those processed meats as much as possible. Being physically active is also an important way to maintain your weight and lower your cancer risk. So, sit less time each day. It sounds very easy. I don't know if you're working from home like we're doing right now. Sometimes we get so busy. I'm in front of the computer, and when I realize it's been 5 hours and I haven't even moved. So, we recommend to try to get up and move for 1 to 2 minutes every hour that you are awake, because sitting too much increases body fat, which leads to cancer and other chronic diseases. So that is the basic thing that we can do. Also, exercise is also a great way to relieve stress, which may be high at this time. I know it helps me getting up, even inside the house. But now that the weather is beautiful, if you can go out around the house, around your block, take a walk. That's the minimum that we can do. But we should aim to get at least 150 minutes of moderate exercise a week. That's really not too much. That is approximately, or it is 2 hours and a half a week. Moderate activity can be just walking, yoga, even mowing your lawn. You can do that. It's considered a moderate physical activity. And also, 2 hours and a half, you can split that every day as you please, like 30 minutes every day if you want to, and as little as 10 minutes at a time. So you can split those 30 minutes in 3 sessions of 10 minutes a day, or maybe 15 minutes in the morning, 15 minutes in the afternoon, however you prefer, but not less than 10 minutes at a time of moderate activity. Now, if you prefer more intense exercise, the recommendation is to aim at least 75 minutes of vigorous exercise a week. That should be your healthy goal. Now, vigorous activity now is going to be more like a running, jogging. You can do fast bicycling or swimming, whatever you prefer. 75 minutes. That should be your goal if you prefer more intense activity. We recommend also do muscle strengthening exercise at least twice a week. Strength training helps you maintain a healthy weight because the larger and stronger your muscles are, the higher your metabolism would be. That means you burn more calories when you are at rest or not active. Now, remember, strength activity, you don't have to go to the gym to do machines or weights. You can use your own weight as well, or you can use, milk jugs or cans or even water bottles to do some strength, but your own weight also works as well. Tobacco use is the most preventable cause of death. Cigarette smoking is directly responsible for 80 to 90% of all lung cancers. Smokers are more likely to have serious consequences from respiratory illnesses like COVID. So quitting now would be a big step toward improving the health of your lungs, heart, and immune system. Now, you may think, well, I don't smoke, so what's the problem? But if you second-hand smoke, as you probably know, it comes from the end of the cigarette or pipe or cigar or smoke that is exhaled by a smoker into the air. This kind of exposure puts you at risk for cancer, heart disease, and other respiratory complications. So the best way to protect yourself and others from secondhand smoke is to request that smoking not to be indoors. Now, give me a thumbs up if you think that e-cigarettes are a good way to quit smoking. I don't see any, so that's true. E-cigarettes are not proven to be an effective way to quit smoking. E-cigarettes deliver nicotine into the body when a user inhales an aerosol of liquid nicotine that comes from many flavors. The aerosol is not harmless water vapor. They have not been proven to help smokers quit. So the best way to quit is using a combination of counseling, nicotine replacement, in the forms of patches or gums, and medication. That's the best way to quit smoking or using tobacco. Using e-cigarettes may damage your respiratory system. That damage is likely to increase your risk for COVID. So it's another important thing to remember. Kids and teenagers should not use e-cigarettes. Using nicotine before the age of 25 can damage the parts of the brain that controls the attention, learning, mood, impulse control. So we should really encourage teenagers and kids to not use any tobacco products, including e-cigarettes or any of these. I don't even know their names, to be honest with you. There's so many of them nowadays, and parents should be aware that, because sometimes parents don't even know them and they seem so harmless. So just be aware that some brands are called Juul, pods, I don't know, vaping, any of those things are not recommended to teenager, kids, or adults for that matter. Now, number 5 is limit alcohol. Now, drinking even a small amount of alcohol increases your chances of cancer. So, for cancer prevention, it is best not to drink alcohol at all. Sorry. If you drink, limit yourself to 1 serving of alcohol per day if you're a woman, and 2 drinks per day if you're a man, once in a while. So, what is that serving size? So it depends on what is that the type of drink that you have in the serving size. For example, it would be 12 ounces of beer is 1 serving size, or 5 ounces of wine, or 1.5 ounces of liquor. That's the serving size. Now, also remember, drinking alcohol can disrupt your sleep and make it harder for you to exercise and eat healthy. That could have a very negative effect of the immune system as well. So avoid that. Number 6, get vaccinated. There are certain viruses that are known to cause cancer. One of these is the human papilloma virus, or HPV. This is a very common sexually transmitted infection that can lead to a number of different cancers, including cervical cancer among women, throat cancer for men and women as well. HPV infection is extremely common. It's believed that 9 out of 10 people will get it. Almost everyone. So HPV, if you can get a vaccine, it would be the best way. Now, give me a thumbs up bottom if you think that HPV vaccine is recommended for both boys and girls. Yes, HPV vaccine is for both men and women, boys or girls. HPV vaccine series protects against cancer. So remember, the vaccine is safe and effective, and the HPV vaccine can prevent close to 90% of cervical cancers. So MD Anderson recommends that all males and females can start getting their HPV vaccine as early as 9 years old, all the way to 26 years old. They should receive the HPV vaccine. The most effective age, the vaccine is most effective when they receive the vaccine at ages 11 or 12, but they can get it as early as 9 years old. Now, for males and females after 26 years old, between 27 all the way to 45 years old, you should still strongly consider getting the vaccine. You should talk to your doctor about getting that vaccine between ages of 27 and 45. So, with that said, it's between the ages of 9 to 45, people still can get the vaccine, males and females. Okay, so another thing is, don't skip the vaccine because of fear of COVID. It is critical for your child's lifelong health to get the vaccine. Okay, get a hepatitis B vaccine, because hepatitis B causes liver cancer. You may have been vaccinated as a baby or a child against hepatitis B if you were born in the United States. If you were born outside the United States, or if you're a child of someone who was born in countries or regions where hepatitis B infection is common, you should be tested for hepatitis B. Hepatitis B can be treated if you have it. Now, let's talk about screenings. MD Anderson has specific cancer screening recommendations for men and women based on their age. Don't let COVID stop you from getting medical help or for ongoing symptoms. Don't let fear or the virus delay your routine screening test. Okay, so let's go and start with women. The recommendation for women in the 20s should start getting the pap test or look for signs of cervical cancer every 3 years, beginning at age 21. And also consider getting clinical breast exam every 1 to 3 years, beginning at age 25, to look for signs of breast cancer. Women in the 30s should continue testing for cervical and breast cancer. MD Anderson recommends an HPV test in addition to the pap test started at age 30. And if everything continued to be normal, now you can get the test every 5 years instead of every 3 years, and continue your clinical breast exam every 1 to 3 years. Women in the 40s should continue testing for cervical and breast cancer and HPV. Now we recommend that you start your yearly mammogram every year. Also, at age 45, forgot to mention, Black women should start getting the colonoscopy or colorectal cancer screening. For the rest of us, the recommendation is to start at age 50, the colonoscopy, and continue with the pap test, mammogram every year. Now, the only new thing would be starting at age 50, the colonoscopy every 10 years if everything is normal. For Black women at age 45, they should start earlier, the colonoscopy. For ages 75 or older, talk to your doctor about the benefits and risks of screening so you can make an informed choice. Now, men, beginning at age 45, men should speak with a healthcare provider to determine if prostate screening is right for them. Men with a family history of prostate cancer and Black men should have this discussion earlier. Black men also should begin the colonoscopy at age 45. For the rest of other ethnicities, men should start a colonoscopy at age 50 and continue doing every 10 years. And if you choose prostate cancer screening, you should continue testing as indicated by your previous results. Same thing as women. Once you reach age 75 or older, talk to your doctor about the benefits or risk of screening. Now, hepatitis C causes liver cancer and non-Hodgkin's lymphoma. Unfortunately, there is no vaccine against hepatitis C. Baby boomers, those who were born between 1945 and 1965, are at especially high risk for hepatitis C infection. So you should get tested. If you have hepatitis C, it can be treated. The treatment success rate is about 90%. Number 8, protect yourself from UV rays. Skin cancer is the most commonly diagnosed cancer in the United States. Often this results from too much exposure to sun or use of tanning beds. The best way to do this is to stay in the shade and avoid going outdoors between 10 a.m. and 4 p.m. when possible. When you do find that you need to be outdoors, the best way to protect your skin is to use broad spectrum sunscreen or SPF of 30 or higher, and covering up with dark, tightly woven clothing. Wear sunglasses that provide both UVA and UVB protection. Wear a hat with a large brim to protect ears and neck. Know your family history. It's important to know if people in your family have had cancer. This information, along with your personal health history, helps your healthcare provider find out if you're at increased risk. Now, remember, only about 5 to 10% of cancer cases are hereditary. If you suspect a family member cancer could be hereditary, the family should consider genetic counseling and testing to determine each of individual's risk. So let's review what we just mentioned. The 9 ways that you can do to prevent your cancer risk: maintaining a healthy weight, eat plant-based diet, be active, sit less, move more, don't smoke or use any tobacco product, limit alcohol, get HPV and hepatitis B vaccine, get tested for hepatitis C and cancer, like breast, cervical, colorectal, prostate cancer for men, protect your skin from the sun, and know your family history. So that's what I have for you today. And let's see if we have any questions or comments. I like comments too.
Doesn't look like we have any questions.
We can remind Gracie and that when you post this in your website, if they still can type questions or comments. If there's questions, please let us know, and we'll be happy to answer those even after today's presentation. So that's all we have.
Well, thank you. I wrote myself some notes. I need to talk to my doctor about HPV and Hep B next time I go to my doctor visit. So I thank you for that information. And not to be out between 10 and 4, and then I need to exercise. I put that on my list. I was like, okay, what's the minimum that I have to do? And then you said 10 minutes a day. And I was like, okay, I think I can handle that. And I think you're so right. We been working from home the last year. It's so easy to stay right here, las tabas, and just keep working. And then you just lose track of time. So, sometimes that's actually why I don't wear my little watch anymore, because I got annoyed when it kept telling me to get up because I was too busy working. But I really should, take advantage of that.
Yeah, the minimum is every hour. Let's get up, move around for a couple of minutes, 3 minutes. But remember, we need to aim to 150 minutes a week. So you can split that 30 minutes every day. 15 minutes in the morning, 15 minutes in the afternoon, or 3 sessions of 10, at least 10 minutes.
Yes.
But every day is 30 minutes, not 10 minutes every day.
Oh, darn. Well, thank you for correcting me. Thank you for correcting me. I'll update my notes. They're minutes a day.
And Gracie, in the chat box, I did put links to our everything that Patricia covered today are in our print materials that are available online, so you can look at them, because I know sometimes you hear it and then it kind of just goes through your ears and you get busy. So the print material with this information is in the chat box, and we'll make sure to email it so you can send it out. The BMI chart that Patricia referenced in the beginning is also on there, so you can look at it and kind of tell, this is my height and this is my weight, this is where I'm at. To give you
sometimes we don't even know that we are overweight.
Yeah, I was too scared to look at the BMI chart when you mentioned it. I was like, I don't really want to know, but it's important.
Yes, it would help. It would help to know. It would help to know, because once we know that we might be overweight, then we know that we need to maybe work a little harder and doing our physical activity, reduce our calorie intake, whatever we do, it would help.
Which is very hard in our culture. We like to eat tortillas, and we like to eat rice with carne guisada. It is very hard in our culture to adjust to, what did you say? Two-thirds of our plate have to be fruits and vegetables.
Let me tell you, we have very healthy foods as well. I lived in Oaxaca for a while, and I know all the central part of Mexico, especially, they have a lot of veggies. They're fantastic. My mother was from Oaxaca, and we grew up eating vegetables, veggies every day, but once a week we would not eat meat.
Oh.
So
Wow.
there's a lot of variety of vegetables around the country. In our culture, we can get used to that. Sometimes we just need to try it,
Yes.
different dishes, but yes, I know it's a challenge. It's a challenge, but we need to start being more aware about very high caloric foods, because obesity is a challenge problem in our culture.
Yeah. Yeah. And you're right. I think the most important thing is to be aware so that we can make our informed decisions, like you mentioned in the presentation. So definitely. Well, if there's no other questions in the chat box, thank you, ladies. Ms. Patricia, Ms. Yvette, thank you guys for being here with us. Thank you, MD Anderson, for sponsoring this event. We really do appreciate the information that you provided to us. And again, like I took my notes, I hope people took their notes. And it's good to know that they can still ask their questions later.
Yes.
As we post this on our YouTube channel, so that people like me understand exactly what we heard. You know, I kind of got tunnel vision when you said, well, I thought I heard 10 minutes, but I didn't hear 10 minutes 3 times a day, because I'm like, oh, that's a lot. So it's good that we can come back and ask these questions, you know.
Absolutely.
It's important to maintain good
and
habits.
also I remind you that we're gonna be back with in doing another type of presentation in Spanish. So please invite all the participants if they want to hear it. It will be a different kind of presentation, but also very important. We're gonna be discussing in Spanish the portion size. We're gonna help us how to start look at our portion size, eating healthy. I know, like you said, Gracie, it's a challenge, not only for our culture, I think for everyone, but we need sometimes a little reminder or some ideas how to, maybe we can do it in an easier way, I guess. So
yes, baby steps.
Yes.
So thank you. And Ms. Patricia is right. We will have another session in Spanish coming up soon. So please invite friends, invite anybody that needs to hear this information, even though we may not want to. It is important. It is important information.
Yes. Well, thank you. And thank you, everyone, for joining us. I hope you still can invite people to go to the website and see the video. And yes, if you still have questions, type them and they're going to let us know. And I'll be happy to answer.
Perfect.
Thank you.
Thank you again, ladies. Everyone, have a great morning.
Thank
Bye-bye.
you. Bye.
Bye-bye.